We're doing just Juicy here with a little video for you fast bowlers, getting a lot of questions at the moment about low back injuries and things like stress fractures and stress reactions. So just sort of talk through it a little bit in some of the ways we look into it and how we can help you. So with fast bowlers, like we said, one of the biggest injuries they get in is the low back stress fracture. Now right arm bowlers, typically where you'd find that is in the lumbar spine between L3 and L5 and the left hand side. And that pain will start presenting when you're bowling. It can be quite a numb pain going from that lower left hand side and round or even up a little bit higher. But what you normally get it is if you go into extension and then to that side, that pain normally comes back. So if you are experiencing that, make sure you go and see a sports physio or a sports doctor, someone like that, to get proper diagnosis. But we're just going to talk about a few things, why it happens and what we can do to put it right. So, like we said, it happens in that lower left-hand side for right-hand bowler, opposite for a left-hand bowler, and it's due to a combination when you're bowling of excessive lateral flexion, rotation, and extension. Those things are all happening in the vertebrae, and they're coming together, and over time, that's making a little crack, and that's a stress fracture. Or before that, we get a hot spot, a stress reaction. And obviously, when you get that, then you're going to have a bit of time out of the game before you come back. So we're just going to talk about how we can possibly get ahead of it, or if you have got it, how we can come back from it. Okay, so how do we fix it first of all? So once you've got it, and then there's going to be a bit of time when you're going to be out of the game. Okay, so what we got with the hips is, if you think he's looking forward here, we've got the hips, a lot of people sit in an anterior pelvic tilted position, so basically almost a duck ass position of there. Okay, and then a lot of the anterior then is always going to be working higher than the posterior. And what we want to do is try and get out of that position. Now, a little tip here: if you're doing bilateral loading in heel lifts to try and get an extra bit of help for your squats and deadlifts, this can exacerbate that position and put more emphasis on the anterior. We want to be strengthening the posterior a little bit more. Okay, so we're always trying to get that back to neutral. And how we can do this is a few things. We've got some screenings we can do, like some of the FMS we work with Performance Frontline on, and we look at the overhead squat pattern, we look at single leg stance in the hurdle step, and we look at a lunge pattern. And those things can normally tell us what's going on a lot. So if someone, and typically what you'll see is a right arm bowler, say the hurdle step, we talked about this before, they go onto the left leg straight away, up and over, fine, nice and stable. As soon as they're on the right leg, wobbling all over the shop. Okay, and the thing with the single leg stance, what that can do with you is, if you're then, we've got your little mate here, just going to do a little squat, and he's got his legs ready there. And if you've got one side working harder than the other, got 100k on this bar. If the left side's working harder than the right, it could have 70% then going through that side. Okay, and then if you see it a lot, squat at the bottom, we're going a little hip shift, normally left, but if the other side can happen, and we're getting a shear force effect there. Now, we can get a perfect storm here. If we've not got this, no, we're not saying squat's a bad exercise, it's just a bad fit for someone who's going to do something like this. Okay, get your single leg stance right first, and then make sure we're getting as stable as possible before we get into this sort of thing, because we don't want that shear force to be reacting with the spine when we're already getting the lateral flexion, extension, rotation from bowling. We want to make sure we clear all your movements and everything, and then let the bowling take care of itself. Okay, so we want to clear this, and then if you are going to go into a squat pattern, make sure we're getting as much as we can, 50% both sides, to limit any injury risk with exercise. Because if you think about what we're doing in the gym, we're trying to make you ready to bowl. We don't want to bust you for bowling. Okay, so we've got to really think what's going to be the best exercise for you to help you improve your mobility, your stability, your strength, your power, everything, so we can then transfer it outside. There's no point us doing things in the gym which are going to hurt you. So that's why we screen to see, okay, now what the best exercise is going to be for you. Okay, so we talked about the pelvis. We want to get it neutral, and we want to get rid of any asymmetries. One of the good tests for seeing if the pelvis is neutral or not is to do a reach test, and all you can use, very simple, get a tape measure and a slider down. How far out can you take it? Both sides. Okay, so we're looking at both sides. How far can you take it? And we want ideally to be within 4 centimeters of each other. So if your left side can take it 38 centimeters, but your right side only 28, we know you've got an asymmetry somewhere in that pelvis. Then what do? So then we look about taking you off your feet into half kneeling positions, into tall kneeling positions, look at your rolling patterns, stuff like this, to try and get everything back to neutral. And this shouldn't take too long, okay? And we're not taking strength off the table completely. What we're doing is saying, right, let's take it back, get everything neutral, get everything stable, and then we can start adding the strengths, the specific power stuff, and the bonus specific stuff later on. But let's make sure we take any asymmetries, especially in that lower half, off the table. Because if you think where the pelvis is, so you've got the pelvis there, your lower back there, we want those to be in harmony, okay? And typically what we can see then, if they're not in harmony, we've got your hips and your thoracic, which is your upper back. Those two start losing their mobility. Now, a typical thing, you can see in bowlers all the time, you can just watch a fast bowler on TV today in one of their test matches or in a T20, and they walk and they can hardly move, hardly disassociate thoracic from the lumbar. Okay, so they've got no thoracic ability to rotate, to extend, and that plays havoc again with the lower back, because that has to do the work for it. And we don't, there's going to be movement in the lumbar spine, but we don't want excessive movement, okay? We want it to be able to move, but we want it to be so strong that the hips and the thoracic off it have the mobility that they need. So what we need to do again through screening and through a process of watching movement, see where the big problem is. Is it your hips? Is it your stability? Is it your mobility? Take it off the table first, and then we can plan and go forward. And this is key when you've got a stress fracture, how then to plan going forward from there. Because we want you guys who haven't got the access to physios, S&Cs, sports doctors, to have something in place, because some of the things that we're hearing from people messaging saying they've had a stress fracture 2 years ago and they're still not able to bowl. So what we're going to do is underneath this, there's going to be a link to click. What you do then is just enter your email address in, and we'll send you a 12-week back to bowling plan, which is based around the stuff we've been doing with the typical stress reaction, stress fracture, and most sort of lower back injuries, okay? And that's for you. And then from there, you can ask us any questions. Obviously, you can join up the inner circle, do the one-to-one plan, things like that. But we just want to put something out there to help you, to show you things that have worked with fast bowlers and can hopefully work with you. And so join up, get it, ask any questions, and we'll speak to you soon.